In today's course, we're going to continue on about the hospital patient safety grades per Leapfrog. Because whether you simply want to know about the hospitals in your area or you need to choose a hospital for any upcoming surgery or procedure, the Leapfrog safety grade should be your first stop from finding the best hospital for you and your family. As I've said, many hospitals have world-renowned surgeons and equipment, but they do not always prioritize your patient safety above anything else. And you deserve to know which hospitals are the best to keep you protected from patient harm. That's why the Leapfrog group developed this tool. And it can help with several decisions in several number of situations you're in. Has your doctor referred you or a family member to a hospital for surgery? Are you preparing to have a baby? Is someone in your family suffering from chronic illness that could require not only immediate or consistent hospital care? I'm going to tell you a little brief example of a client, and then I'm going to show you an example of what could have helped this patient out. I received a call from a loved one whose family member was 51 and tripped bringing in the groceries and broke their leg. This patient had a pre-existing heart condition. Without consulting her heart doctor, a surgery was performed to repair her broken leg. By the time the family called me, the patient was in kidney failure, and as an advocate, there was nothing I could do. The patient died 3 days later, and it was all preventable. If this family had known about or looked up the Leapfrog grade ratings, they could have been a more proactive patient and asked good questions, and I truly believe the patient would still be alive today. Now, I'm going to share my screen like I did last week. And so remember, we went to the leapfroggroup.org, and you go down here to visit your hospital grades. And then I'm going to search by zip like I did last time. And I'm going to use a hospital, and it is not this hospital that this patient went to. So I want to preface this. I'm just using it as an example. The hospital the patient went to was a C. And so when you open it up, you can view the full score. What that means is you can look at infections. Red is bad, green is good. You can see all the different infections. You can find out problems with surgery, safety problems, and what are they doing to prevent it. So this person was having surgery, and the particular hospital, so it was not this one, as I said, that says death from a serious treatable complication, it was in red. And what that meant is that you can read down here, sometimes after surgery, patients can develop serious complications. They might catch pneumonia, have a heart attack, or lose function in their kidneys. That's what happened to this patient, because the heart was not addressed, and these were not concerned. You're allowed to talk to your healthcare team that you're aware of the hospital safety grade and about any of these areas so that they're more in tune with your loved one. So what happened was this particular patient, in my opinion, would still be alive today if this family would have been a more proactive patient. So, like I said, that's just an example. You know, if you or your loved ones need a surgery, just look to see how your hospitals compare. You can look up pregnancy, C-sections, mortality rates, ICU. It's a conversation piece. And, you know, some people have asked, what if my city or my area only has D hospitals? Well, if that's your only option to go to a D hospital, that's fine. But let the doctor know that you're aware and do your homework and know what issues they are having in the hospital, especially around infections, so that you can be part of the team and keeping your loved one safe. That's what the whole point of this is keeping you safe in the hospital. Please make sure you subscribe, share, like, or comment. I would appreciate it. And until next time, I hope you have a great day because I have a passion for patients.